When you reach for a handful of nuts, you're likely thinking you're making a smart, healthy choice, especially as a senior aiming to stay active, independent, and vibrant. Nuts are often praised as nutrient-packed snacks, and that's true for many, but not all nuts are created equal. Some can quietly harm your health, raising risks like liver damage, blood sugar spikes, or even interfering with medications you may be taking. Others, however, are like superfoods, protecting your heart, strengthening your bones, and keeping your mind sharp as you age. In this guide, I'll walk you through a clear, simple plan to choose the right nuts for your body and limit the ones that could work against you. This isn't about eliminating nuts from your diet. It's about understanding which ones actively support your health goals and which ones might be silently undermining them. By the end, you'll know exactly which nuts to keep in your pantry, how to enjoy them safely, and why these choices matter for your long-term well-being. Let's dive into how these small snacks can make a massive difference for older adults looking to thrive in their golden years. Nuts are a go-to snack for many because they're seen as a wholesome alternative to processed foods like chips or cookies, and that instinct is spot on. They're packed with nutrients like healthy fats, protein, and minerals, making them a convenient and satisfying option. But for seniors, the stakes are higher when it comes to food choices. As we age, our bodies process nutrients differently, and conditions like high blood pressure, diabetes, or bone loss become more common. The wrong nuts can increase inflammation, destabilize blood sugar, or clash with medications, which can complicate health management. On the flip side, the right nuts deliver compounds that fight the aging process, protect your brain from cognitive decline, and keep your heart and arteries strong. A 20-year study published in a leading cardiology journal revealed that one commonly eaten nut could increase the risk of liver damage by nearly 48%, while others can significantly lower your risk of heart disease and mental decline. This guide will break down which nuts to embrace and which to avoid, so you can make informed choices that support your health every day. Let's start with almonds, a true powerhouse for older adults. These nuts are a fantastic choice because they're loaded with nutrients that address some of the most pressing health concerns for seniors. A 1-ounce serving, about a small handful, provides roughly 97 milligrams of calcium, which is comparable to 1/4 cup of milk. This is crucial for maintaining bone density and preventing osteoporosis, a condition that becomes a bigger concern as we age. Strong bones are essential for staying active and independent, whether you're gardening, walking, or playing with grandkids. What makes almonds stand out even more is their magnesium content, which works hand in hand with calcium to ensure it's absorbed into your bones rather than building up in your arteries or soft tissues, which can increase cardiovascular risks. This calcium-magnesium synergy is like a natural defense system for your skeletal health, keeping your bones sturdy without compromising your heart. Beyond bones, almonds are packed with antioxidants, particularly in their skins, where flavonoids team up with vitamin E to create a powerful shield against oxidative stress. Oxidative stress is a process where harmful molecules damage cells, contributing to aging, memory problems, and a weaker immune system. By fighting this, almonds help protect your cells, support skin health, and may even preserve memory function, which is vital for seniors who want to stay sharp. The vitamin E in almonds also plays a role in skin health, helping you maintain a youthful glow and resilience against environmental damage. For your heart, almonds deliver about 9 grams of monounsaturated fats per ounce, the same kind of healthy fats found in olive oil. These fats lower LDL, bad cholesterol, while boosting HDL, good cholesterol, keeping your arteries flexible and supporting overall heart function. Plus, with 3 5 grams of dietary fiber per serving. Almonds promote digestive regularity and further help control cholesterol levels, making them a daily must-have for seniors who want to feel their best. Next up is walnuts, often called the brain-boosting nut, and their benefits are hard to overstate. Their wrinkled, brain-like appearance is almost a visual clue to their most powerful function, supporting cognitive health as you age. Just 1 ounce of walnuts provides about 2.5 grams of alpha-linolenic acid, ALA, a type of omega-3 fatty acid that's essential for maintaining the structure and flexibility of brain cell membranes. This helps neurons communicate effectively, which is critical for seniors who want to maintain mental clarity and quick thinking. Research from a prominent university shows that the omega-3s in walnuts improve cognitive flexibility and processing speed in older adults, helping you stay sharp for daily tasks like managing finances or enjoying hobbies. This is especially important because age-related cognitive decline can start subtly but impact quality of life over time. Walnuts also contain polyphenols and vitamin E, 2 potent antioxidants that can cross the blood-brain barrier, a protective layer that controls what enters the brain. This ability allows them to reduce inflammation directly in neural tissue, which is a major driver of conditions like Alzheimer's disease and other forms of cognitive decline. Chronic, low-grade inflammation in the brain can erode memory and thinking skills, but walnuts help counteract this, acting like a natural defense for your mind. Another unique benefit of walnuts is their small amount of melatonin, a hormone that regulates sleep-wake cycles. Many seniors struggle with disrupted sleep, which can affect mood, energy, and mental sharpness. By including walnuts in your diet, you may improve your sleep quality, which in turn supports overall well-being. Whether you're solving puzzles, reminiscing with friends, or simply enjoying a good night's rest, walnuts are a simple, delicious way to protect your brain as you age. Now, let's talk about pistachios, a small but mighty nut that's a champion for heart health. At about 160 calories per ounce, pistachios are a lighter option compared to some other nuts, but they pack a serious nutritional punch with a balanced mix of plant-based protein, healthy fats, and antioxidants. What makes them especially valuable for seniors is their high potassium content, around 285 milligrams per serving. Potassium helps neutralize the blood pressure-raising effects of sodium, which is critical for older adults managing hypertension, a condition that affects many as they age. Clinical studies published in a respected nutrition journal have shown that eating pistachios can lead to meaningful reductions in systolic blood pressure, helping you keep your heart in top shape. This is particularly important for seniors who want to stay active and avoid complications like heart attacks or strokes. Pistachios also shine when it comes to blood sugar regulation, making them a smart choice for the many seniors managing type 2 diabetes or insulin resistance. Their low glycemic index means they don't cause rapid blood sugar spikes, and their blend of protein, fiber, and healthy fats slows the absorption of carbohydrates when eaten with meals. This helps prevent those post-meal blood sugar surges that can leave you feeling sluggish or increase diabetes risks. Beyond heart and blood sugar benefits, pistachios support vision and brain health through their high levels of lutein and zeaxanthin, 2 carotenoids that protect the macula, the part of the eye responsible for sharp vision. These compounds may reduce the risk of age-related macular degeneration, a leading cause of vision loss in older adults. Emerging research also suggests that lutein and zeaxanthin may play a role in maintaining mental acuity, helping you stay focused and alert. Pistachios are a versatile, heart-healthy snack that can make a big difference in your daily health routine. The fourth nut to include is Brazil nuts, which offer unique benefits but come with a critical caveat. These nuts are an unmatched source of selenium, a trace mineral that plays a vital role in thyroid function, immune health, and cognitive protection. Just one large Brazil nut contains about 96 micrograms of selenium, which is more than the daily recommended intake for most older adults. This makes Brazil nuts less of a snack and more like a natural supplement wrapped in a shell. Selenium is essential for converting thyroid hormone T4 into its active form, T3, which regulates metabolism, energy levels, and mood. This is especially important for seniors, particularly post-menopausal women, who may face thyroid issues that cause fatigue, weight gain, or brain fog. By supporting thyroid health, Brazil nuts can help you feel more energized and balanced. Selenium also protects neurons from oxidative stress, which is linked to cognitive decline. Studies suggest that low selenium levels are associated with worse memory and thinking skills in older adults, while improving selenium status can support clearer thinking and better mood stability. Brazil nuts' benefits extend to immunity as well, helping your body fight infections and stay resilient. However, their high selenium content means you must practice strict portion control. Eating more than one Brazil nut a day, 2 at most, can push you towards selenium toxicity, which can cause symptoms like fatigue, stomach upset, brittle nails, hair loss, or even nerve dysfunction. To stay safe, stick to one Brazil nut daily, and always consult your doctor if you're taking medications for thyroid, blood pressure, or cholesterol, as nuts can sometimes interact with these treatments. Brazil nuts are a powerful addition to your diet, but moderation is key. Now, let's discuss the nuts to limit or avoid, as these can pose serious risks for seniors, especially those with specific health conditions or on multiple medications. First up are peanuts, which are incredibly popular but carry hidden dangers. Unlike true tree nuts, peanuts are legumes that grow underground, making them prone to contamination by molds that produce aflatoxins, potent carcinogens that can damage liver cells over time. Seniors with weakened liver function or compromised detoxification systems are especially vulnerable to these toxins, which can impair immune function and increase long-term health risks. Research from a liver health organization highlights that even low-level exposure to aflatoxins can be problematic. Additionally, peanuts are high in omega-6 fatty acids, which aren't harmful in small amounts, but can promote inflammation when consumed in excess. Many seniors already get too much omega-6 from processed foods, and peanuts add to this inflammatory burden, potentially worsening arthritis, heart disease, or cognitive decline. For these reasons, it's best to treat peanuts as an occasional indulgence rather than a daily snack. Cashews are another nut to limit, primarily because they're surprisingly high in carbohydrates. A 1-ounce serving contains about 9 grams of carbs with only 1 gram of fiber, meaning they can spike blood sugar more quickly than other nuts. This is a concern for seniors managing pre-diabetes or diabetes, as blood sugar spikes can lead to energy crashes and long-term complications. Cashews also contain oxalates, natural compounds that can bind with calcium in the digestive tract, potentially forming kidney stones. For seniors with reduced kidney function or a history of urinary stones, cashews can exacerbate these risks, making them a less than ideal choice. While cashews aren't inherently bad, their carb and oxalate content means they should be eaten sparingly, especially if you're watching your blood sugar or kidney health. Macadamia nuts, while luxurious and tasty, are another nut to approach with caution. They're incredibly calorie-dense, with just 10 to 12 nuts packing around 200 calories, mostly from fat. Unlike other nuts, they offer minimal protein or fiber to keep you full, which can lead to overeating and weight gain, a concern for seniors managing heart health or mobility. Macadamia nuts also have a high saturated fat content, nearly 3 to 4 grams per ounce, which can raise LDL cholesterol and worsen cardiovascular conditions, especially for those on statins or other heart medications. Their rich, fatty nature can also stress the gallbladder, a common issue for seniors with gallstones, which become more prevalent with age. Eating macadamias in large amounts can trigger digestive issues like nausea, abdominal pain, or even gallbladder attacks, so they're best kept as a rare treat rather than a staple. Finally, pine nuts pose unique risks that make them worth limiting. These small nuts, often used in gourmet dishes, can cause a peculiar condition called pine mouth syndrome, where you develop a metallic or bitter taste in your mouth 1 to 3 days after eating them. This can last for days or weeks, suppressing appetite and potentially leading to unintentional weight loss, which is a serious concern for seniors already at risk of undernourishment. More concerning, pine nuts contain compounds that may interfere with common medications like blood pressure drugs, antidepressants, or cholesterol-lowering treatments. These interactions aren't widely publicized, making them a hidden risk for seniors on multiple prescriptions. Additionally, pine nuts' small size and slippery texture make them an aspiration hazard, especially for those with swallowing difficulties or dry mouth from medications. If accidentally inhaled, they can block airways or lodge in the lungs, potentially causing aspiration pneumonia, a serious condition in older adults. For these reasons, pine nuts should be consumed rarely and with caution. To put this knowledge into practice, start with a simple pantry audit each week. Stock up on almonds, walnuts, pistachios, and just one Brazil nut per day. Serve nuts in a small dish, like a ramekin, to control portions. Never eat straight from the bag, as it's easy to overdo it. Keep peanuts, cashews, macadamias, and pine nuts in a separate treat jar to enjoy sparingly. Store high-fat nuts like walnuts and Brazil nuts in the refrigerator to prevent rancidity, as rancid fats can turn beneficial compounds into harmful ones. For Brazil nuts, stick to 1 per day, 2 at most, to avoid selenium toxicity. Research from a major heart health organization shows that seniors who follow structured nutritional guidelines like these have better cardiovascular outcomes, more stable blood sugar, and improved cognitive function compared to those making random food choices. Consistency is more important than perfection, so aim to make these choices a regular part of your routine. If you're taking medications for blood pressure, diabetes, or thyroid conditions, talk to your doctor about your nut choices. Some nuts can enhance or interfere with medication effectiveness, and your healthcare provider can help you optimize both your nutrition and treatment plan. Beyond nuts, your overall dietary pattern is your most powerful tool for healthy aging. Work with your doctor or a dietitian to create a comprehensive nutrition plan that includes nuts alongside other foods that support bone health, heart function, and cognitive performance. Regularly monitor your blood pressure, blood sugar, and cholesterol levels to see how dietary changes affect your health markers. Pay attention to your energy levels, sleep quality, and mental clarity. These are real-time indicators of how well your food choices are working for you. The snacks you choose today can either build strength for your golden years or quietly undo decades of effort to stay healthy. Nuts are powerful foods that can support or undermine your health goals, depending on which ones you choose and how you consume them. The difference between thriving in your later years and struggling with preventable health problems often comes down to simple, informed choices, like which nuts to keep in your kitchen. You now have the knowledge to select nuts that actively support your heart, brain, and overall well-being while limiting those that pose risks. Share this guide with your adult children, grandchildren, neighbors, or friends who want to make smart food choices as they age. Your recommendation could help them avoid nutritional mistakes and build a stronger, healthier future. Stay informed, stay prepared, and keep making choices that support the vibrant, independent life you deserve. This information is educational and not a substitute for personalized medical advice from qualified healthcare professionals who understand your unique health needs.